Hello, my name is Dr. Ivy Branin. I'm a naturopathic doctor here in New York City. And today we're going to talk about anxiety and how anxiety can cause IBS and how IBS could actually be causing anxiety. So whether you have IBS with constipation, diarrhea, or mixed, one way that I like to consider IBS or look at it is as a dysregulation of the gut-brain axis. So what are we talking here when we say gut-brain axis? So the gut-brain axis has 5 main components: the brain, spinal cord, the autonomic nervous system, which is made up of the enteric nervous system, ENS, parasympathetic, sympathetic, the HPA axis, and the gut microbiome. So what exactly is going on when we're really stressed and anxious, and what is happening to our GI tract? So we want to first look at the parasympathetic and the sympathetic nervous systems. When we're stressed out, when we're anxious, our sympathetic nervous system gets heightened into high gear. And basically one way that we can also think about it is our fight or flight system. During that time, blood vessels constrict all along our GI tract, so basically shutting down digestion, plus the sphincters also along our GI tract also become constricted because you don't want to be having a bowel movement when you're running away from a saber-toothed tiger. So there is a point to all this. Versus when we're more in the parasympathetic nervous system, which is governed by a nerve, the 10th cranial nerve, the vagus nerve. This actually activates digestion. So GI motility gets activated, as well as glandular secretion, basically digestive enzymes and acid. And yes, you actually need acid, and actually acid release is more associated with relaxation than stress. And the acid basically breaks down proteins, and it also helps to activate B12. On the other side, if you've seen any of my other videos on stress and anxiety, then you probably are somewhat familiar with the HPA axis, which is the hypothalamus pituitary adrenal axis. And so in times of stress and anxiety, this axis gets activated by a hormone from our hypothalamus called cortico-releasing hormone. When that hormone is released, it actually increases intestinal permeability and inflammation. So if you've ever heard of that term, leaky gut, well, you can kind of blame overaction of your adrenal glands partly for that. Another thing that happens also when CRH is released, you're also going to be seeing an increase in activation and number of your GI mucosal mast cells. So what are those? So mast cells are cells of allergic reactions, basically. It's a very easy way to think of them. And they release histamines. So this is sort of where we can kind of draw an association of why a compromised digestive tract could actually lead to more allergies. Now, getting back to the autonomic nervous system, let's talk about the ENS. So the ENS, again, is the enteric nervous system. And this is where you might have heard this term, second brain. So the reason why the ENS is considered the second brain is because it has similar structure and function to our brain. And even more importantly, it actually produces a lot of neurotransmitters. In fact, 90% of our serotonin is actually produced in the ENS. Now, the ENS has direct communication with the vagus nerve all along our GI tract. But interestingly, the ENS of our small and large intestine actually can function independently. And the ENS is also basically responsible for our immune response, motility, detecting nutrients, and it does communicate with the vagus nerve. Now, as I mentioned before, that anxiety can cause IBS, but then IBS or GI dysfunction can cause anxiety. So how is that possible? The place we want to look is at the gut microbiome. So the gut microbiome also has a big influence on the cells of our GI tract. Now, what are we talking about there? But we're basically talking about all the bacteria that live there. And in time, but what's also during stress and anxiety, it actually can influence the number and concentration of what bacteria reside there. And so as that changes, these bacteria, again, because they're influencing the cells, and remember, the ENS is where we produce a lot of serotonin. So these bacteria, the change, could actually change how much serotonin our body is producing, which, again, if we know that serotonin is very much linked to mood, the bacteria actually can change the way that we feel. And basically kind of keeping us on this vicious cycle. So now that we have kind of an overview of the connection between stress and anxiety and IBS, what are some things that we can actually be doing today to make ourselves feel better? So the first most important thing is stress management and relaxation techniques. Again, because we know that our brain directly influences our GI tract. So what does that look like? So whether you really connect with mindfulness-based activities, things like meditation, breath work, yoga. I personally am a big believer in breath work, and so I lead a morning 8 a.m. breathwork practice on Instagram. Exercise, journaling, body scan. I don't normally talk so much about herbs in these videos, but other like herbs that I really like, specifically when it comes to stress, anxiety, IBS picture, are lavender and lemon balm, also called Melissa officinalis. There's different forms, or you want to do a tea, tincture. Another thing that you want to do, specifically, remember how we talked about that, when we're more in that sympathetic, our digestion kind of slows down, and that can be causing more issues. Bitter herbs, whether it's in a tincture form, a glycerate form, or a tea. Something very simple that most of us have around the house is chamomile tea. And what I like about chamomile is it has both properties. It's a bitter, but then it's also what we call a carminative, which helps to kind of help soothe and relax. And if you are going to use it specifically more as a bitter, you want to do it stronger than you normally would. So I recommend for my patients to do 2 bags steeped for about 20 minutes actually to make it a bit stronger. So it might not be as yummy as you normally have, but that's actually going to be a lot more powerful as a bitter. On the nutrition standpoint, it's a couple factors. Definitely the way we eat has a big impact. Slow, mindful, lots and lots of chewing is going to just help. It's actually will even help to activate the vagus nerve more if we take that time. Fiber. So this is one of these things where sometimes people think that fiber might make them feel worse. It really depends on the type of fiber. For IBS, we typically recommend soluble, meaning fiber from fruits and vegetables, over insoluble, so fiber coming from bran or grains or cereals. So doing more of the soluble versus the insoluble fibers. And then the last part would be probiotics, because again, when we think about how much the gut microbiome actually influences our mood, and then our mood influences our digestion, making sure that we have good probiotics, whether you buy something in the store or fermented foods. Now there is like one caveat, and specifically if you're someone who has or might have SIBO, which is small intestinal bacterial overgrowth, probiotics can often make you feel worse, and there's good reasons, because again, there's such an imbalance. And so it's best to first work with a practitioner to get the SIBO under control before you bring in a probiotic. Also, there's some other, not just probiotics, but also prebiotics, so it has to be very careful. So hopefully that you found that helpful. Again, my name is Dr. Ivy Branin. I'm a naturopathic doctor here in New York City, and wishing you to relax and digest and feel better. Have a wonderful day.